Hello everyone. Today we will discuss imaging features of a dermoid cyst. So this is an ultrasound exam which shows a cystic structure here in the left adnexa on different planes, and the cystic structure contains an internal echogenic eccentric nodular mass, and we will look closer at this finding on the cine images, and these cine images show the cystic structure with an eccentric hyperechoic mass lesion, and this mass lesion demonstrates posterior shadowing. So this is a hyperechoic mass lesion demonstrating posterior shadowing within a cystic mass lesion. This is a very typical appearance of a dermoid cyst, and dermoid cyst has various imaging appearances. This is one of the most common imaging appearance, called as a dermoid plug within a cyst. So this echogenic structure which shows posterior shadowing is called dermoid plug, or it is also called a Rokitansky nodule. So this echogenic structure can contain calcified material such as tooth, or it can also contain tuft of hair. So it can have all sorts of various materials within it, and it is hyperechoic and shows posterior shadowing. Now we'll go over the CT scan of this same patient and look at these same findings of the dermoid cyst on the CT. So on the CT examination in the left adnexa, you can see there is this well circumscribed mass lesion containing low density material predominantly, that is similar in density to the fat, so predominantly fatty material, and this cystic lesion is predominantly occupied by fat material. And again, we see this eccentric nodular mass that we saw on the prior ultrasound on the same patient, corresponding to the Rokitansky nodule or the dermoid plaque. This contains hyperdense material within it. However, we don't see any discrete calcification to suggest any teeth or hair or tuft of hair in there, but this is definitely hyperdense. And the lesion is predominantly fatty, is a well circumscribed lesion in the left adnexa. So this is one of the most common imaging presentation of a dermoid cyst.